Hello, everyone. My name is Joshua Malman. We're going to do another edition of the Bulletin Brief with another RAS author from the August 2021 Bulletin of the American College of Surgeons, which is focused on advocacy. Today, I have with me Dr. Scott, who is a Global Surgery Research Fellow at the University of Massachusetts. And Dr. Scott, you actually covered a topic which I'm quite passionate about, and passionate because frankly, it affects my concerns when I travel internationally, which is road traffic injuries. I have to admit, I go to India to visit relatives every year, and I'm not very worried about the flight there, and generally not worried about anything other than road traffic injuries, which I see on the roads there not infrequently. And as you will describe it in a moment, it's the experience of road traffic injury victims in other countries can be dramatically different because of services that are available than what we experience in the United States. So first, Dr. Scott, could you let us know how you came up with this topic as an advocacy related topic?
Sure. So I think that my interest in road traffic injury really started back when I was in medical school. And it kind of stemmed from there. So I remember being on the trauma surgery service with one of my mentors at the time, one of the trauma surgeons, and we were discussing a patient. And I remember using the term car accident, and I was politely corrected. And he explained that, these aren't accidents. We call them motor vehicle collisions. And the reason is because it's preventable, whether it's speeding or impaired driving, distracted driving, the roads aren't safe, they weren't wearing a helmet, and so on and so on. There are so many aspects of a collision that are preventable. And so we don't call them accidents for that reason. Um, and so I think that that was something that really resonated with me, even from a student getting involved in global surgery. I think that so much of what we do in medicine is very reactive. And so, especially in surgery, we fix the problem, we stop the bleeding, remove the pathology. And so I think if there's anything that we can do in surgery to be proactive or get involved in any kind of prevention, it would really be injury prevention. And so I think that that's kind of where the interest started.
Sure. And the scope of the problem is quite large, is my understanding, that this is not an infrequent issue. You kind of quoted some statistics that it's really common cause of death and morbidity in the younger population in particular.
Yeah, absolutely. So worldwide, road traffic injury accounts for 1.3 million fatalities every single year. So this is a huge public health problem. Um, I think it's the leading cause of death in anyone aged 5 to 29, which is massive. The leading cause of death is road traffic injury for our younger populations. That's huge. So the scope of the problem really is quite massive. It's a very big priority for the World Health Organization. And I think that over the last couple of years, as they've had certain decades of action for road safety, their most recent global strategic plan at the World Health Organization hopes to have the amount of fatalities from road traffic injury by the year 2030. And I think it's certainly doable as long as we have the surgeons and the public health advocates that are willing to get involved and make changes.
So you, in your manuscript, kind of alluded to the fact that surgeons and perhaps academic surgeons in particular are uniquely poised and in a sense set up to be able to help with this issue. Why is that? What skill sets would we provide that are particularly helpful in this issue?
I think to start with, we go through this training paradigm that really sets us up with a kind of an introduction to research and epidemiology. And then as we start to practice, or in my future as I start to practice, I think that the things that set us up well to get involved in this kind of advocacy is our practical insight. We see the patients that come in through the door after traumatic injury. We see the implications for them, the outcomes for them, how long it takes them to recover if they survive. Um, Certainly it doesn't even stop at just the health implications of traffic injury. It goes on and extends to the economic and resource burdens for the system. And so I think that as surgeons, we see that firsthand. We have an intricate knowledge of the injury patterns, the injury mechanisms. And so I think that we're well poised, as you said, to really make changes and to advocate for changes that we see. We see the two different patients that come in, either one's helmeted or one's not, and we see the differences in outcomes for those patients firsthand. And so I think for us in healthcare, we see a different side of it than maybe some of the policymakers that are a little bit more removed. And so I do think it's our job to kind of guide the policymakers and work with them to make changes for the community.
Towards the end of your manuscript, you speak to what we can do at the national level within the United States, kind of domestic policy, but really now focusing on international advocacy. What are and you alluded to some of these elements, but what are the main elements that you would encourage surgeons who are able to do this or have an interest in this area to help contribute in terms of advocacy to reduce road traffic injuries internationally, especially in low and middle income countries?
Sure. So as you mentioned, this is a huge public health problem. It's a massive priority. And in low to middle income countries, they see 90% of these fatalities from road traffic injury. So it really is concentrated in the low and middle income countries, unfortunately. And so I think for those who want to get involved, in advocacy, you can start early. You can start as a student or a resident just by getting involved in the different organizations that advocate for the things that you care about. And so you can get involved as a trainee in the RAS ACS committees. Like I'm in the global surgery work group, which falls under the advocacy committee. As a student, there are plenty of national and international organizations that are involved in global surgery. And I think more practically speaking, there are ways through the college where you can get involved with contacting your local representatives, your congressional representatives, your senators. We have the annual Leadership and Advocacy Summit where they have meetings with congressional representatives. And so you can get involved in that way by spreading the word. And I think one of the most important things when you're having these conversations with people at the government level is they really want to hear anecdotal stories about how this really affects people, because they're not there in the hospital when these patients are coming in injured. And so they don't see the clinical implications like we do. And so I think it's important to keep this at the forefront of people's mind and use things like social media to spread awareness of how this really affects people and things that we can do to make a difference, like advocating for mandated helmet laws and things like that.
I really didn't know a whole lot about this issue and still have a lot to learn. One of the ways that I learned a little bit about this issue is from Dinesh Vyas, who's a surgeon in California. You probably have heard that name, who really has been fairly involved in trying to get initiatives to educate first responders. Because a lot of my concern when I travel internationally is not so much what happens when I get to the hospital, but one is getting to the hospital, and then what gets done until I get to the hospital. What information do you have about that arena, which is kind of the pre-hospital part of trauma care in these low and middle income countries, and anything that we can do to have an impact on that?
Sure, certainly. And I think that the college has done a lot of things in this area, especially with the Stop the Bleed campaign. And so I think that that's one of those things, if you're not familiar with it, it's designed to educate bystanders in first response through the use of tourniquets in the field. And so in trauma, we talk about, the golden hour, or you have 60 minutes really to access definitive surgical care for these patients. Otherwise, they see a huge increase in morbidity and mortality after those first 60 minutes. And so, and that's from the time of injury to the time of getting definitive care. And so anything that we can do, as you said, in the field or in the pre-hospital setting to really help these patients is incredibly useful. And so the Stop the Bleed campaign and teaching people about tourniquet use is incredible. And I think that what they've estimated is that, bystander first aid has the potential to save 1,000 to 2,000 lives annually here in the United States. And that's a huge number. I think other things that you can do as far as pre-hospital care really alludes to surgical system strengthening in other countries, in low and middle income countries. And so for surgeons that are involved in global surgery efforts, this gets to moving kind of away from mission trips and getting more towards surgical system strengthening and helping to build workforce capacity and helping to work on infrastructure to help get these patients to the hospital or to tertiary care centers sooner without those delays in care.
Sure. No, absolutely. I think that I really like how you pointed out that golden hour, because we almost take it for granted that there's a system to try to achieve that goal in the United States, but in other countries, really, I'm not even sure if that's anything that's discussed, because it seems to be a little bit more haphazard in terms of the pre-hospital part of care. Returning back to the United States, you mentioned helmet initiatives. What other key initiatives that you see to reduce road traffic injuries and fatalities?
Sure. So there's obviously the helmet laws, which has been a big thing over the last couple of decades, starting back in the 1960s. Unfortunately, that's still an issue because back in the 1960s, we had instituted the Highway Safety Act, and almost all of the states in the country, I think we were up to 47, had universal helmet laws. And then as kind of federal policy shifted, and they decided that they couldn't really institute any penalties or take away highway construction funds from these states, those laws started to be repealed. And I think we're down to about 19 states out of our 50 that have universal helmet laws. And so the college is continually advocating to have more states instate those universal laws again. Other things that have been done in the last several decades, obviously, would be the use of seatbelts. Other things, including not just inside the car or on the motorcycle itself, would be road safety. So installing guardrails, installing bicycle lanes to make sure that bicycles have their own paths to travel down the road. Making more frequent use of crosswalks, making the crosswalks more visible and safe for pedestrians, building overpasses so that we don't have people trying to cross highways in urban spaces. Those are all important measures that are still being worked on to make the roads safer for everybody.
Seems like there needs to be a tremendous collaboration almost between civil engineers and surgeons. Really a group that, frankly, I had never thought of really collaborating with. That's a really great point. A lot of the work that you mentioned seems like it's locally focused or state focused. If with surgeons obviously have limited time, I imagine that all of us do. How do you decide where to best deploy your advocacy time, or what have you found as the most effective way to deploy your advocacy time, and what would you suggest for others?
I think that there's a reason that a lot of things are done at the local and the state level first, and it's because it's easier. It's easier to I don't want to say attack these policies, but advocate for policy change on a local level and a state level, because that's where most of our public health measures are instated to begin with anyway. I think if you try to start big at a federal level, it's going to be very difficult. You're going to be met with a lot of opposition from all kinds of lobbyists or, motorcycle riding groups that really just want the wind through their hair and the freedom to choose and that kind of thing. But if you start at the local and the state level, I do think that it's a little bit easier to kind of make your point and get your thoughts heard.
Sure. Well, again, a really important topic, something I also think from a personal standpoint that I care a great deal about. Well, thank you very much, Dr. Scott, for your time. Really important work and an important issue for us to be involved in, not only in advocacy within the United States and within our state and locally, but also in terms of international advocacy, which is something I don't think we very much we talk about very much. So thank you again for your time.
Thank you so much.